Great. Hello, everyone. Good afternoon. Welcome to World Water Week, Thursday live session, online session. My name is Dr. Om Prasad Gautam. I'm the hygiene lead for WaterAid in UK. First of all, on behalf of WaterAid, London School of Hygiene and Tropical Medicine, and JICA, we would like to welcome you all on this particular session on sequentially modeling climate resilient hygiene and wash intervention in a school. Unfortunately, this will be just 1 hour session, so that there are very packed agenda we need to kick through. So you will be listening to us at the same time. Feel free to type your question into the chat box, and we'll have the opportunity towards the end to answer some of your question. Within 1 hour, we'll start with welcoming you, highlighting objectives, followed by we'll have a context setting presentation. And then we will introduce a sequential trial. It was implemented in 3 countries, followed by we'll have 2 country case study presentation. Once we have the country case study presentation, then we'll have a dedicated time for question and answer with dedicated facilitation. So why we are here today and what are we going to learn together within 1 hour? So through this session, we're going to share evidence-based climate resilient wash services and hygiene behavior change intervention, how those interventions can be designed, implemented, and evaluated specifically in low and middle income countries. Then we'll share a proof of concept intervention and its sequential results based on the cluster randomized trial that we have implemented in Madagascar and Tanzania and cross-sectional study in Nepal. So we'll be presenting some of the outcome of the climate resilient wash infrastructure, the outcome from the infrastructure and light intervention, and combined effect of climate resilient wash infrastructure and comprehensive hygiene intervention. Followed by, we will focus on question and answer. We will wait your question. If there is no question, our focus of discussion will be how do we sustain and scale up proof of concept, climate resilient wash service, and hygiene practices at a school. Feel free to type a question into the chat box, as I mentioned earlier, and then we'll have series of presentation followed by dedicated question and answer session. We will answer as we move to the presentation, but we will also have a dedicated question and answer session if you want to hold your question towards the end. With that note, without further ado, let me invite Dr. Yuji Wataka. He is our colleague from JICA. He's WAS advisor, and he will be giving you how climate change intersects with WAS, specifically focusing on a school setting. Over to you, Agata-san.
Thank you, Dr. Om. So this is Ryuji Ogata from JICA. As an introduction, I'd like to make a presentation on the overview of climate and washing in school. I hope this presentation accelerates the understanding of the following presentation related to the washing in school. Next, please. So first, why washing in school is important. Number 1, health and disease prevention. I think everybody understands this point, which means the washing school preventing the spread of disease and promoting the health. So number 2, improved learning environment. Cleanliness improve the student concentration, productivity, and performance. So number 3, promoting the hygiene and well-being. If the student learn proper hygiene at the school, then they can tell it to their family members, and it promotes hygiene culture outside of the school as well. So number 4, impact of the attendance and the academic performance. About this, some studies evidence improved the washing in school, especially menstrual hygiene, lead to increased attendance of the female student. So next, please. Next, this slide shows the interpretation of the adequate provision of washing in school. First, adequate provision of washing in school protect the right and preserve the dignity of the children. And second, that is non-discriminatory ensure the equitable access to quality education. Third, that help to create a conducive learning environment. Fourth, that means the disease prevention and promotion of health and well-being. Finally, for adequate provision of washing schools, sustainable infrastructure and those operation maintenance and management are necessary. Next, please. This slide shows the definition of washing schools. So there are three categories such as drinking water, sanitation, and hygiene. The level of service were highest as basic, next as limited, and no service. That washing household have 5. Next, please. So this slide shows the global status of the washing schools in 2023. Basic level of water supply in 2023 was 77%. Sanitation as 78%, and hygiene as 67%. Those are, of course, getting better compared with those in 2015, but need to accelerate more in the future if we'd like to achieve 100% service by 2030. Next, please. This slide shows the status of wash-in schools in Madagascar, Nepal, and Tanzania in 2023. For Madagascar, data for drinking water and hygiene was quite insufficient in half of the schools. And we found that the 44%, 30%, and 50% of schools didn't have drinking water, sanitation, and hygiene facilities, while 39% of the schools achieved basic level. Next situation in Nepal. It was better that 55%, 39%, and 42% of the schools accessed basic level of drinking water, sanitation, and hygiene facilities. In case of Tanzania, firstly, data for drinking water and hygiene was quite insufficient, as 77% and 85% of the schools could not specify the status. Other than that, we can find that 23% of the schools showed no service for drinking water. For the sanitation and hygiene, 44% and 15% of the schools access basic level of service. Next, please. So this slide shows the understanding on the impact of climate change on wash in schools and measures to be taken for climate resilient wash in schools. Impact of climate on wash in schools are firstly, water scarcity could be occurred by the drought. Water contamination, it could be occurred by the flood or sometimes drought. Flood and cyclone may damage the infrastructures of washing schools. Flood also lead increased disease burden, and flood and drought may lead educational disruption. Therefore, we need climate resilient wash in schools through such as water resource diversification, climate resilient infrastructure, hygiene promotion activity, community engagement, formulation of policy and plan, and implementation of the investment and human resources. Through these activities, we may overcome or mitigate influence of the climate change on wash in schools. Next, please. Thank you very much. This is the end of my presentation.
Thank you very much, Agata-san. Excellent deliberation. In summary, colleagues hearing online, If you have any question to Agatha-san, feel free to type into the chat box or wait towards the end of the presentation. Just would like to sum up the context. There is a fundamental importance of climate resilient wash services and hygiene behavior change into the school settings. If we have climate resilient wash services and hygiene behavior change, it will protect children's health. It will be so that children can able to learn, children can able to attend the schools. It will improve education. Children will not miss school. It will also protect equity and inclusion aspects of the children. The dignity will be protected. It will support the well-being of the school students. And of course, it will build a lifelong habit for school students to sustain their good hygiene so that they can practice into the schools and into the household environment. With that note, we would like to move into the next presentation. So I just would like to remind colleagues here, many organizations and of course the government are implementing water sanitation hygiene services and hygiene practices, the intervention in school settings. So now with this, in this particular session, we are talking about climate resilient wash services and hygiene intervention. So the fundamental question here is, in order to ensure climate resilient wash services and hygiene behavior change programming, do we need to transform the way we are currently implementing our intervention, or is it something that we need to strengthen what we are currently doing in order to ensure sustainable wash services and hygiene into the school? This is a fundamental question for everyone to think. From now onwards, for all the colleagues attending in this session, I would like to encourage you to think, going through this presentation, can you think of one answer? By going all of these presentation that we are going to present and showcase, do we need to transform the way we are currently implementing it, or with some strengthening, kind of, some sort of integrating climate resilient aspects into the ongoing intervention can change the, can improve and ensure the resilient services and behavior into the schools. So think about that. So now we'd like to move on. So the next presentation, I'm going to lead this presentation, and you need to bear with me for another 12 minutes. In this presentation, I'm going to cover a trial that we have implemented in Madagascar, Tanzania, and Nepal. In this trial, I'm going to highlight how we have sequentially modeled climate resilient hygiene services, wash services and hygiene behavior change program, particularly focusing on different level of intervention, primarily starting from the infrastructure with light intervention and comprehensive hygiene intervention. Why we have set up this cluster randomized trial in 3 countries? All of these 3 countries has wash in school national standards or guideline. But of course, everyone into the sector, including government, recognize that if we don't make these ongoing services climate resilient, the service will be disruptive. There will be high pressure into the schools, the school absenteeism, the health will be health of the school students will be compromised, education will be compromised. Those services need to be climate resilient, and those hygiene behavior change intervention has to be more sustainable. In this case, WaterAid, with the support from JICA, try to model and pilot climate resilient wash services and hygiene intervention in 74 schools. So the focus of my presentation, therefore, is going to look how we have designed, implemented, and assessed the climate resilient wash services and hygiene behavior change in those 74 schools in Madagascar, Tanzania, and Nepal. The focus of the intervention was to sequentially model wash infrastructure, followed it by light intervention and comprehensive hygiene intervention in 74 schools, targeting to 28,400 students. The outcome of this particular trial was measured using a cluster randomized trial before-after with control in Tanzania and Madagascar, and in cross-sectional study before-after without control in Nepal. This particular diagram shows how we structure, how we sequentially model the trial, and then how we cross-sectionally measure the outcome for Nepal. So in my right-hand side, as you can see here, the sequential trial that we have implemented in Madagascar and Tanzania. So right-hand side. So what we have done at the beginning of the trial, we have standardized climate resilient wash services in 60 schools in Madagascar and Tanzania, 30 schools, because we want to standardize wash services before we actually do the baseline. After baseline, then we have divided those 60 schools into 30 and 30. 30 became intervention, 30 became control. In those 30 schools in Madagascar and Tanzania, we have introduced a very light cognitive type of intervention in order to see whether light intervention has any effect in changing the behavior. After that, we have done the RCT follow-up assessment. Then only we have introduced a comprehensive hygiene behavior change intervention, but both in intervention and control group, because we don't want to leave anyone without intervention. You can see here we have model wash infrastructure, followed by light intervention and comprehensive intervention. Whereas in Nepali schools, in 14 schools, all of them were intervention. We have standardized the wash services at the beginning, then we did the baseline and the end line. In between, we have a comprehensive hygiene intervention. So in my presentation, I'm going to cover how we phased the intervention in all 3 countries. Because we really wanted to test a proof of concept intervention. So therefore, we applied behavioral science while designing, implementing, and evaluating these interventions. So we have used a behavior-centered design approach in order to design the behavior change program. At the beginning, we have assessed what is already known about the WAS resilient infrastructure in the existing schools. We also assessed the existing conditions, and then followed it by we did the formative research to understand the behavioral determinants, including the climate related threats, hazards, and feasibility of building resilient wash infrastructure in those school settings. Once we did the formative research, then we have work with the creative agency involving government, the creative thinkers, the scientists, the creative agency, the climate change experts, behavior change experts together in order to design 2 types of intervention. One, climate resilient infrastructure. Second, very robust hygiene behavior change programming. So part of the delivery, since this was implemented at a school, so what we have done, we have delivered through the school-led mechanism. We have used the school teachers in order to deliver the intervention, and we have hired the contractors, trained contractor to build the facilities. Part of the delivery, we started with infrastructure, light intervention, and comprehensive intervention. So here in this slide, you can see we have modeled some of the climate resilient wash infrastructure in schools. In left-hand side, you can see the precondition, that those were the conditions before we started the intervention. In right-hand side, how we improve those scenarios. Because those intervention, we really wanted to make it climate resilient. So we have installed very diverse source of water, including rainwater harvesting, elevated water tank. We have also installed water treatment. At the same time, we have also installed gender-separated inclusive toilet with raised platform, sealed pit, safely managed services. It was not only the sealed pit, but it's safely managed, the on-site containment of the fishes. Then we have also installed group hand washing facilities at the entrance of the school, closer to the toilet, in different locations of the school, so that those behavioral products and services are accessible to the school students. Then that was the first phase. Then, of course, after that, we assess the baseline status, providing all infrastructure, what proportion of school students practice the behavior. Then, before we go to the second phase, I just would like to highlight the behavior that we have targeted. We have targeted multiple behaviors for the behavior change intervention. We have targeted hand washing with soap as a primary behavior. Then we have included drinking water, clean use of sanitation, food hygiene, waste management, and menstrual hygiene. Those 6 behaviors were promoted through the hygiene intervention. So in the second phase, after the baseline, we have implemented only light intervention. Because look, I think there is a notion into the sector that some of these behavior change interventions are quite lengthy, quite expensive. Can we have the light intervention and see whether that changes behavior or not? We wanted to testify. We knew that cognitive intervention is not going to change. The posters, leaflets is not going to change anyone's behavior. But at the same time, we didn't have much data to prove it. But therefore, we wanted to see whether this cognitive type of intervention can work. What we have done in the second phase of the trial, we have introduced the light cognitive intervention, which is manga cartoon, implemented in 3 months, 6 exposures in Madagascar, and then we have only used jingle with school students 3 months, 6 times within Tanzanian schools. So very light intervention, manga cartoon and the jingle, and we assess what is the effect of these light intervention followed by the infrastructure. The third phase of the intervention, once you have RCT follow-up, then we have introduced a comprehensive hygiene behavior change intervention. Again, 6 exposures, 6 exposures. With those intervention, we really wanted to have very comprehensive engagement with the school students. We use 3 levers for behavior change. We have designed a very emotional activities that demonstrate the behavior change, that highlights the benefit of practicing behavior. There are lots of games and competition. The second lever for behavior change we have used is changing the behavioral settings with behavioral cues and nudges. Third, we have also introduced some social norms related activities, including competitions, public rewards, and recognition. So the 3 level of activity, as you can see in these slides, the motivational activity, which is game, competitions, letter exchange, demonstration. The second second set of activities, behavioral nudge, which is like such as footprints coming from toilet to the hand washing station, finger pointing stickers for people to point and where they should be washing their hands, cleaning stickers, wall painting. Third, there were lots of competitions and public reward for school students who practice those behaviors. So all 3 activities implemented together, part of the comprehensive hygiene intervention. Then we assess the effect of these intervention. The question is, where the intervention successful was resilient infrastructure, light intervention, and comprehensive intervention was effective in changing the behavior. Left-hand side, I would like to focus on this. Once we implemented all comprehensive WAS infrastructure, then we assess whether school students are practicing behavior at all 3 critical moments, before eating, after defecation, and after play. Only 11 to 8% school students were washing their hands in those 3 critical moments, even if there were infrastructure soap available. Only 11 and 8% control and intervention. Then when we introduced the light intervention, there was a little improvement, but then when we had our RCT follow-up, it went down almost into the same level. So that means, provided all the infrastructure is there, light cognitive intervention doesn't change anyone's behavior. Educational intervention doesn't change anyone's behavior. Then we did a comprehensive hygiene intervention, both in intervention and control group, and we see the peak improve from 9% to 87%. And there was a similar effect in both the group, because we have introduced the intervention both in control and intervention group. From this, we can conclude that the infrastructure, though put a foundation, is not enough. Light intervention doesn't work. Comprehensive intervention, it works. And right-hand side, as you can see here, there will be case study presentation from country. I'm not going to go in detail, but as you can see here, the exposures, we also assess the behavior by exposures. 2 exposure, 25%, 64% improved by third exposures, and we have implemented, as soon as we finish all 6 exposures, the behavior improved from 25% to 97%. So that means the attribution of the trial was 72%, where you can confidently say that the one-off exposure is not enough, multiple exposures are necessary. So what are we concluding? This is my final slide, just to conclude that the resilient WAS services act as a precondition for behavior. We should be very much mindful of installing climate resilient WAS services with adequate operation and maintenance at school. The participatory creative process is identical and fundamental to change to design very robust, resilient infrastructure, and also design robust hygiene behavior change intervention. High reach and frequency of exposure, maintaining high fatality. The sessions were delivered by trained school teachers, were effective in leading the behavior. So the comprehensive hygiene intervention, emotional activities plus nudge plus precondition, which is a resilient infrastructure with high level of reach and exposure, implemented by trained teachers, can lead a behavior change as a proof of concept. And cognitive model of behavior change, just putting manga cartoon or telling people to do this and that with jingle is not going to work. It's not going to add any value. So after this trial, all the country has developed a handbook, and those handbooks are actually adopted by government, and the next stage is to scaling up these initiatives in other countries. I mean, in other respective schools in the respective settings in the respective countries. I'll stop there. So that was the trial, and that was the overall effect of the trial. Now, with that note, I would like to now invite our colleagues from country from Tanzania and also from Nepal. You'll be hearing 2 country case studies. Those will be brief, 8-minute presentation. The colleagues from Tanzania, we have Miss Rebecca Stanley, and she will present hygiene behavior change and WAS in schools in diverse climate, but she will detail out the trial that we have implemented in Tanzania. Over to you, Rebecca. You have 8 minutes.
Thank you very much, Dr. On. My name is Rebecca. I'm from Tanzania, and I'm going to present the case study of Tanzania. Next slide, please. Just to introduce you to our national context, in Tanzania, only 53% of schools have basic services, and just 49% have functional hand washing facility with soap. The previous speakers mentioned, which SWASH club structures limit peer-led hygiene promotion, leaving behavior change efforts inconsistent. As for the climate change link, Tanzania is increasingly facing drought, unpredictable rainfall, and floods. Climate extreme damages water supply infrastructure and contaminate sources that disrupt sanitation systems. Through JICA funding, we implemented a 3-year project in 30 primary schools, which aimed to enhance hygiene behavior and improve washing services in schools. Next slide, please. To implement the project, we used the BCD approach and the ABCDE model of implementation, which the previous speaker explained. We did formative research, and we used the assets to build based on the insights from the formative research. We brought together a multidisciplinary team and created a campaign that was named Umenawa, and we delivered an soft in cognitive intervention in 15 schools through the randomized control trial, and later we did an endline, a comprehensive intervention in 30 schools, and this was followed by an endline. Next slide, please. As for the preconditions, the climate resilient construction work plan included rainwater harvesting tanks, which had month-round supply. We raised platform and reinforced structures to prevent flood damage, which are low maintenance. We had gender sensitive and inclusive toilets, which had water access. And why is it climate resilient? Because it reduces the reliance on vulnerable pipe systems and maintains hygiene during drought and floods. Next slide, please. In terms of hygiene behavior intervention, we exposed the students through 6 hygiene sessions, which had different games. One of the games was child life game. This we also had wheel of hygiene, ring game, snake and ladder game. All these games that we introduced used innovation and creativity, which was interactive, fun, and competitive. And we also added visual cues, takeaway pins, stickers, and mirrors to the children. And we used their motives, which were driven by pride, role modeling, and recognition to help them to change their behavior. Next slide, please. These are some of the interactive sessions. As you can see, we have the child life game. We also awarded the ideal students. As you can see in the 6th session, they were receiving their certificates. So this is just pictures showing the hygiene sessions being delivered. Next slide, please. Regarding the hygiene behavior change skill, we also installed static nudges And these static nudges were placed in strategic places at schools to remind the students to observe the key behaviors. And as you can see, there's a mural wall. The students are walking on footprints installed, and there's a toilet there with key hygiene steps being shown. But in terms of mobile nudges, you can see the students are touching fans. These fans had the sixth behavior change um, uh, printed so as to remind them to observe the key behaviors. Next slide, please. What was the key results in schools during the end line? 100% of schools had functional accessible stations near toilets and in compounds. And this was after we did the end line. And this is because we did the preconditioning before we did the behavior change. But when it comes to attendance, health and school attendance, after during the end line, we discovered that there was improvement in school attendance. During the baseline, 12% of students were not going to school. 35% of students were not going to school, but now it's improved, and only 7% and 12% of students 6% of students were not going to, had not gone to school. And the preferred hand washing times in terms of observed behavior were reported 77% before eating and 92 after using the toilet. So in a nutshell, the end line proved that the behaviors for the students had improved drastically compared to baseline, which was after the infrastructures were installed and after when the comprehensive intervention was done. Thank you, Dr. Let's go to the next slide. The key conclusion was combining nudges, emotional activities, and wash services provision drives higher behavior adherence. Multiple exposures, seats with higher reach, are crucial in sustaining change, and evidence generated through formative research helps the participatory creative process to ensure resilient hygiene infrastructure. But climate resilient infrastructure is essential for continuous hygiene practices despite environmental challenges. And also proof of concept hygiene intervention are ready to replicate in other schools. And jointly, we developed a handbook with government to ensure that this is going to be adopted. Thank you very much for listening.
Thank you very much, Rebecca, for the excellent presentation and deliberation on the detail of the trial implemented in Tanzania in those 30 schools. With that note, now let me invite our colleagues from Nepal, where the climate resilient water services and hygiene behavior change intervention was implemented in 14 schools and assess its effectiveness. For the presentation, let me invite Sajani Lembu and Yogesh Ranamagar from Nepal. Over to you, colleagues. You have 8 minutes.
Thank you, Dr. Wong. Hi, everyone. This is Yogesh, and I and Sajani Limbu, my colleague, will be presenting on the climate resilient wash services, hygiene interventions in Nepal's schools. Based on the JMP report 2023, the basic water, sanitation, and hygiene services are 55, 39, and 42% respectively. Recently we are facing the climate disaster related events. Unfortunately, right now in the Madhya province of the Nepal, in the Birganj, there is cholera outbreak, and also last month there was a disaster crisis announcement in the Madhya province due to the drought. So in these slides, there is a climate change scenario of the Nepal has been discussed, and sanitation systems are also affected by the climate disasters, which increases the risk of contaminations. And Various researchers have said that adequate hand washing facilities and hygiene practices in schools are crucial for the preventing waterborne infections. There are policies in place like School Sector Development Plan, National Sanitation and Hygiene Master Plan, and wash in schools guidelines in place in Nepal, encouraging the environment-friendly wash facilities in the schools. So there is robust climate-resilient wash sector is needed, and interventions in the schools based on WASH improves the health, attendance, and academic performance. Various research have said that. Next slide, please. We had the JICA funded improvement of hygiene behavior in schools, healthcare facilities projects implemented in 14 schools of the 3 municipalities of Sira from September 2021 to June 2024. In collaboration with the government of Nepal, creative agency, WaterAid, implementing partner, and research partner. As previously presented by the Dr. Om and the colleagues, there was the BCD, behavior-centric design approach, which is ABCDE model. So firstly, the preliminary assessment was done to identify the climate resilient wash infrastructure are there or not. So it was ensured first, then there was formative research to identify the key bottlenecks, key barriers of the hygiene improvement in the schools. Then the package developed and session delivered. You will be, my colleague will be sharing those things in details. Next slide, please. For ensuring the climate resilient wash services and hand washing facilities infrastructure in the schools, we had a periodic test of the water quality in the schools and the treatment of the water based on the water quality issues. There was also alternative sources of water were ensured from the municipal water supply connection where possible, so that safely managed water for drinking and hand washing was available in the schools. And there was also the inclusive, accessible and disaster resilient sanitation and hand washing facilities, that is with the elevated water treatment units, elevated toilets, and the hand washing facilities, making it flood resilient. And there was focused 6 key hygiene behavior sessions to the students for prevention of the disease like waterborne disease like diarrhea, cholera, dysentery, etc. Now I want to hand over my this session to the Sajani. Thank you.
Thank you, Yogesh. Good afternoon and good evening, everyone. I'm Sajani Limbu. I'm the Behavior Change Communication Specialist here at WaterAid Nepal. And I'll be walking you through the next segment on how Nepal team delivered the HBC interventions. So after construction and rehabilitation of climate resilience and inclusive hand washing facilities and toilets, operation and maintenance trainings were provided, and these facilities were handed over to respective schools. After 1 month of cooling period, a baseline study was conducted before the implementation of HBC interventions. Next, 3-day HBC package training was conducted, and the trained teachers delivered the 6 HBC sessions focusing on 6 key hygiene behaviors over 6 months. The HBC package had innovative interventions, which reinforced hygiene rituals such as group hand washing and used creative activities to establish social norms. On the right, you can see the key activity of each sessions. I won't go into detail as this has been repeated in previous slides by other colleagues. So after HBC implementation, 1 month interval of cooling period was kept and online study was conducted. Next slide, please. Okay, so along with the interactive HBC sessions, there were visually attractive nudges both in static and mobile format. On the left, there are static nudges such as wall painting of all 6 hygiene behaviors, footprint to direct users from toilets to the hand washing stations, finger pointers showing flushing of toilet after use, eye sticker and finger pointer to wash hands with soap and water, and fly nudge to reduce mess and frequent cleaning of toilets. And on the right, we have mobile nudge or takeaways such as notebooks with colorful pages of 6 hygiene behaviors. We have the name stickers, bookmarks, mirrors with hygiene behaviors, and letter of certification for model students. Next slide, please. As for the results, here we can see the analysis of the baseline, monitoring visits, and online studies, where it showed increment in both knowledge and observed behaviors. So on the left, you can see the knowledge of the critical moments for hand washing among school children. And the most increment in the knowledge of hand washing is for after playing outside. That was 55% increment, followed by after using toilets and before eating. As for the observed hand washing behaviors at critical moment, there was an overall of 73% increment from baseline to end line, with 21% at the baseline and 94% at the end line. And the most increment observed was for playing outside. That was at 76%, followed by before eating and after toilet. Next slide, please. So in terms of key learnings, inclusive and participatory engagement during the creative process with diverse stakeholders is very crucial, especially the engagement of government representatives, because this encourages accountability in the maintenance and implementation of wash facilities and HPC sessions. Also, training to teachers capacitated the existing human resources so that they could cascade the sessions and institutionalize the package. Having attractive HBC interventions that are surprising and engaging with high student reach and frequency of exposure can lead to reinforcement and significant behavior change. Similarly, combining these activities with climate-resilient wash preconditions for hygiene behavior change is necessary to enable the practice of hygiene behaviors. And lastly, the O&M mechanism needs to be in place and ensured by respective agencies for long-term sustainability. So on the right, we can see a snapshot of the learning brief. Thank you.
Great. Thank you very much, Sajani Limbu and Yogesh Ji from Nepal for your excellent presentation, case study presentation on how the climate resilient wash services and hygiene behavior change was introduced in school settings and what was the effect of those interventions to create as a proof of concept for government to replicate in other settings. Thank you very much. Colleagues, with that note, so we are on right time. So we have finished all our deliberation. So colleagues online, hopefully you might have been hearing all of these, and you might be still thinking that question to make our ongoing work wash in schools, primarily wash services and hygiene behavior change. Does it need a more transformative shift in order to integrate climate resilient wash in schools and healthcare facilities? I mean, in schools, or we need to have a very transformative way of changing our work on ensuring climate resilient wash in a school setting. So think about that as we start discussing ourselves into this. And I'm thinking about the presentation that we have delivered collectively. With that note, without further ado, now let me invite our colleagues, Professor Dr. Robert Diverbris from London School of Hygiene and Tropical Medicine, and he will facilitate the question and answer, and he will do some dedicated facilitation here. And Robert, you will have 15 minutes for this dedicated facilitation, and over to you, Robert.
Sure. Well, thanks, and thank you for the presentations. I think probably the easiest thing to do would maybe have some of our panelists or some of the speakers here go ahead and turn their cameras on, just so we can start kind of engaging, no kind of strange pauses on that. Just a reminder to everyone that's joining online, if you could please, if you have questions, go ahead and enter those into the chat. We'll kind of facilitate those and post those to our speakers today. So I'm going to start with a question on kind of the links between the interventions and some of the other kind of standard approaches that we see here. So some things like the 3-star approach that's commonly used in schools. How does the kind of WaterAid, this climate resilient intervention, with or without the behavior change component, align with these kind of global standards for kind of Washington schools and Washington school programs? And I apologize if my voice is giving out. I'm a little sick today. So I think you might be best aligned to kind of speak to that one. So.
Thank you very much, Robert, and colleagues, whoever has put the question in line there. I think there are two ways. One, of course, 3-stars approach has been implemented in multiple countries. I think designed together with multiple partners into the sector. And then on top of this, each country has was in schools guidelines and standards to make sure that the type of infrastructure need to be implemented in schools and also the behavior change campaign to be delivered. Some countries where we work, and the 3-star approach has been also ingrained part of the national was in school standards, and where we have actually followed that process, and those standards are being in place when it comes to ensuring resilient facilities. But for behavior change, of course, we have our standard approach, behavior center design approach. We go through this approach, we assess, we understand the behavioral determinants, we understand motivations, then collectively we design a comprehensive hygiene behavior change intervention which are more engaging, appealing, moving away from this traditional type of leaflets and posters type of intervention, because we know those not going to change behavior. Then we make it more attractive, engaging with motivational activities, nudge, and so forth. That's kind of what the standard way of delivering behavior change program, moving away from this very traditional deliberation. So I think the question was also specifically, Robert, was to Nepal. I just would like to hint, just linked with that question, whether in Nepal, Sajani and Yogesh, did you apply the 3-star approach on that, or you use the national standards?
Yeah, thank you so much for the questions. Yeah, firstly, I will try to answer the questions. Yeah, wasn't school standard in Nepal, and definitely we had the GMP standard as well. So firstly, we ensure the standard wasn't school standard, and then the GMP basic standard. But our ambition was not to declare the 3-star or star approach in the schools. Our attempt was to ensure the climate resilient was infrastructures, then see the effectiveness of the hygiene intervention. So the basic standard was according to the WAS standard in the school in schools in Nepal, but our main aim was for the hygiene interventions effectiveness assessment, or that type of intervention was there. So yeah, basic standard was ensured through the was in schools procedure, but the star approach, we did not go to the star declaration approach. Yeah, thank you.
Okay, back to you, Robert. So kind of, as you can see, the design varies depending on the national standards.
Mm-hmm. Yeah, no, thanks. Looking here, we have a question from a colleague in Rwanda, specifically kind of working on Washington schools in kind of rural areas. Kind of, can you talk a little bit more about some of the challenges facing hygiene services in rural areas, maybe linking that back to these specific, climate resilient services? How does that work? How kind of are there specific challenges in these rural areas compared to urban environments? And how that aligns with some of the behavior change programming that you did. Maybe, yeah.
Maybe country colleagues start, then I will come for the behavioral elements. Maybe start from Rebecca, because it's from East Africa. Rebecca, would you like to highlight?
Hello. Yes, can you hear me?
Please go ahead.
Yes, the question is, have you built a hygiene facility in rural areas? The project that we implemented was in a rural area in Kisarawe. Kisarawe is one of the rural areas which is in Pwani. So yes, the hygiene facilities were constructed in the rural areas. And we understand the challenges that are in rural areas. And that is why even through the hygiene handbook that we have developed, we are expecting it to be adopted in other schools which are in other rural places. But we also realize that not only rural schools that have challenges, but also urban. So we want through the handbook, we hope that it will be the handbook will inform hygiene behavior change interventions in both rural and urban settings. I hope that answers your question.
Thank you.
Can I come in, Robert, on this?
Yes,
Yeah,
please.
thank you very much. And some of the common challenges that we face, I think, when we did the formative research all across 3 countries, I think some of the common challenges the students are facing because they didn't have the resilient WAS services. So what happened, basically, students go to their schools, they don't have inclusive facilities, they can't, they can't wash their hands if they may in a certain time frame into the year because the water is not available throughout the year, soap wasn't available, and those are not available into the specific locations where need to happen. And we have seen with the flooding in Nepal, for example, this project was implemented in Trai area, also in Kisarawe, in Tanzania, and also Madagascar. Some of the facilities previously built was also flooded, and those were not functioning. So that means the people, school students had to go for often defecations. And we have seen the schools becoming sometimes also epi-centre in terms of transmitting disease. We have seen the high prevalence. We have also recorded period prevalence of diarrhea, by the way. We didn't report here because the sample size was quite low, but we still assessed the period prevalence of diarrhea, and we have seen 23% school students in last 2 weeks had diarrhea. So that means that during baseline, the significant number of school students are actually facing health challenges. And then we have also witnessed that these school students are also facing other challenges, including skin disease and so forth. So the climate-related hazard were assessed at the beginning, and then also some of the coping mechanism at that particular moment, the students are actually, and their level of awareness, that do they link, for example, diarrheal disease with the flood, for example, diarrheal disease with the drought, the rainfall pattern they are experiencing linked with that or not. So kind of try to understand those behavioral determinants. What we did part of the design process, working with the curative agency, including the subject experts, behavior change, and also the climate change experts, we try to make sure that we have very much context relevant infrastructure that are resilient in line with the national standards. But at the same time, for behavior change, addressing those behavioral determinants, the coping mechanism that the school students are already doing it, but making it, bringing a resilient angle to it, so that these facilities are functional throughout the year, and then the behavior are reinforced through the government-led school mechanisms. So yeah, so the intervention is trying to address those barriers, and as you can see, the results are significant because all the preconditions were there. The behaviors are motivated, prompted in any specific locations. Some of the challenge that we face, Robert and colleagues, whoever asked this question, was in a neighboring village into the respective community, the water was not there throughout the year, and in some of the cases, the neighboring community started feeding the rainwater harvested water in from the schools, and that was actually had a huge impact on limiting water access to the school students. And we had to conduct lots of interaction with the community not to do that because the rainwater collected water was limited for students to actually wash hands throughout their year. Yeah, so those are some of the problem and how we actually address that. Back to you, Robert.
Great. I think the next question on here was about kind of the tailoring and adapting to the local context. So I think we covered that with there. There's another interesting question. I'd pose it first to kind of our in-country colleagues. Is how involved were the schools in both the planning for both these kind of the service improvements and the behavior change programmings? Kind of if you could discuss a little bit more about how the schools fit within this, and then once this was up and running, what's the role of the school in continuing and sustaining this? Are they expected to kind of maintain these these hygiene interventions? How has O&M for these services been kind of incorporated into the school programs?
Yeah, I think I should answer some. Firstly, the WAS facilities were assessed, either they are climate resilient or not, and either they meet the basic standard of the WAS in its schools guideline, WAS facilities, which should be guided by the national guidelines, WAS in its schools guidelines. So firstly, this was assessed first, and the gaps were identified. And with the consultations and discussion with the school management committee, and then the teachers, concerned teachers and their stakeholders, the designs were confirmed, meeting the standards. and then all the management committee and the teachers were together during the design and construction phase as well. They should monitor, they were giving feedbacks if there is something wrong, or they were together. And after the constructions of the wash facilities, for the operation and maintenance of the to functionalize the wash facilities smoothly, for the sustainability perspectives, already there was operation and maintenance plan with the schools, and there was training to the operation and maintenance focal person of the schools about the operation maintenance plan, and there was daily checklist which that responsible staff should tick either that the water available or not, and hand washing stations and the sanitation toilets are clean or not. Every day he or she should check, so that daily checklist was there, and the staff were trained in that way. So operation and maintenance goes in that way. And even after the projects, even after the interventions, there is some schools were encouraged, or some schools continued to conduct the sessions, hygiene sessions in the schools, and municipalities or local governments were also motivated and expand those sessions and those intervention in all the areas of the municipality. Yeah, I added this, and if something you want to add, Sajani.
Yes, I would like to add on that. So that was mainly the part of infrastructure in terms of operation and maintenance. So as shown in the previous slides, in terms of how we engage the diverse stakeholders. So even during framing workshop and in the creative workshop, we had engaged school teachers, we had engaged education coordinators from the local municipalities, from all three municipalities, to be part of that creative workshop and to actually design the activities in terms of when should we have HBC sessions in schools. And they were the one who identified that there is a weekly, in a week, there's one day dedicated for extracurriculum activities where the kids just go and play. So it's an open day for the school. So that was the day identified by the teachers where we can have HBC sessions, because it also included games and interactive sessions. So that was one of how engaged and involved they were in the planning, and also in terms of the different activities, if this was practical or not, and what kind of interventions, what kind of messagings and everything. So from creating the package in terms of scheduling it in the school's routine, and also in terms of monitoring the school, the students' behavior for awarding the students to be model students. So that was the kind of commitment that they had. And even when the sessions ended, when the package ended, when the research ended, they were very much looking forward to planning to do this again during the ECA. So that was how they were very committed to it. Yeah.
Great, thank you. Before we kind of move to our last question, Rebecca, any kind of insights from Tanzania about kind of involvement with the kind of local schools, and kind of the sustainability of these, or the kind of ongoing operations and maintenance of these new facilities?
Yes, in addition to what the other country did, what we did in Tanzania is we also included the school governing committee. The school governing committee is made up of teachers, but also parents. So these parents, in case there is any operational maintenance issue, they are involved. And through the school parent-teacher meetings, they will be informed of what are the gaps, and they will all come together to see how they can solve it. But also we have wash clubs, like I mentioned earlier. The wash clubs are also responsible to ensure that in case there's any, to monitor day-to-day operations, but also in case there's anything that they have seen is not working, they will report immediately, and the teachers, since they were all trained on operation and maintenance, and they were given toolbox in case there's any small maintenance issue that will need to be addressed, they will quickly come in and ensure that it has been worked on. So in addition to what others have mentioned, that is what we also did in Tanzania. Thank you.
Okay, thank you. Well, I see we're right at time, so I think there's just a few more questions in the chat that unfortunately we won't get a chance to cover today. It would be good, if we could all kind of maybe is to walk away and kind of reflect on the question from Joan Wheaty about the kind of role of kind of climate resilience WASH services in schools. What does this mean about climate resilient education systems, and making sure we're kind of considering kind of our WASH services in the context of our kind of broader climate resilient approaches. So with that, thank you very much.
Thank you very much, Robert, for the excellent facilitation. Colleagues, if there are a few unanswered questions, as Robert mentioned, we'll try to respond as much as possible. We can also respond. I mean, you can also connect individually with us. We're happy to answer those and discuss. And then, of course, there is the narrative into the sector that, I mean, whether we need to have very transformative, resilient infrastructure or initiative into the sector, or we can strengthen and integrate climate resilient aspects into the ongoing WASH in school intervention, so that at least we are addressing anything that we do are resilient and comprehensive enough to deliver service and ensure the behavior change. With that note, colleagues, we only have 4 minutes to conclude because we have extended additional 5 minutes. So anything from JICA side, because JICA was one of the funder for these initiatives. We have collaborated quite strongly with our funder into this. Ogata-san, do you have any final word to say? 1 minute.
Yeah, okay. Thank you very much, Om-san. So thank you for the presenter from WaterAid and moderator. So firstly, maybe I'd like to mention why we initiated this project. So one of the main reasons of starting this project was to learn the method of the behavior change activity for the WASH in schools and healthcare facilities from WaterAid. So as you know, the WaterAid had extensive experience in hygiene promotion activities, so that we can formulate the WASH handbook for the schools and the healthcare facilities for JICA ourselves as well. And based on the mentioned result of the so far, so we hope to extend similar activity in the other countries and regions. In that sense, we'd like to discuss with the related organization and government officials how we can proceed such activities on climate resilient WASH in schools in the future. So yeah, lastly, I'd like to express my gratitude to our important partner, WaterAid, for their tremendous effort for successful completion of the project. Yeah, thank you very much. That's all.
Thank you very much, Agata-san, for this excellent deliberation, and thank you on behalf of WaterAid and also from 3 government ministries for your financial contributions and technical contribution to this. With that note, colleagues, thank you very much, everyone, for your active participation into this. And this has been quite incredible exercise for this particular cluster randomized trial that we have implemented in all across 3 countries to operationalize WASH in schools standards in all 3 countries and create proof of concept intervention together with the government, so that climate resilient WASH services and behavior change intervention are implemented in scale in other settings. We have been continuously working with the government, with the respective government, to operationalize these learning to the other settings. And glad to hear that in Tanzania, in Nepal, and also in Madagascar, we discussed this morning that these guidelines are being operationalized in other schools and settings. With that note, I would like to express my sincere thanks to all contributors, presenter, and also moderator. So thanks to Sajani, Yogesh, Ogata-san, Rebecca, and also Dr. Robert from London School of Hygiene and Top Medicine. With that note, colleagues, thanks all the participants for your active participation and listening. With that note, this might be the final last online sessions for World Water Week. I'm sure everyone might have enjoyed the very long, intensive World Water Week conference, and I think all are invited to the last closing plenary after this session, if you are in person in Stockholm. With that note, thank you everyone, and thanks to everyone for your contributions. Bye for now.
Thank you. Thank you, everyone.